For years, we've been following through on the troubling rates of infant and maternal mortality in Cuyahoga County. New data shows the child mortality rate in the county is 25% higher than the state of Ohio and 41% higher than the United States. But this morning, Tiffany, there's a new push to tackle this head on, and this is just an ongoing issue that you've been keeping tabs of.
It truly is, and it's great to see so many people trying to do something about it. Now, we've talked about some improvements in those numbers in recent years, but this problem runs deep. There's a collaborative effort with new funding that could lead to change.
Pregnancy takes its toll on the mind and body.
So I was a high-risk pregnancy, blood pressure, my age, and just health issues that I had before.
Joy Johnson says she was also under a lot of stress.
My son ended up coming at 24 weeks. So I had a premature baby at 1 pound.
One area where she found some relief was not having to worry about food. She received a box delivered to her home with nutritious food tailored to her medical needs. It's something the Greater Cleveland Food Bank started during the pandemic and continues today.
We're seeing reductions in things like stress, depression and anxiety, and we're seeing a trend towards later birth time. So people are carrying their babies longer, which is the bigger predictor of infant mortality.
Alyssa Glenn is the director of community health and research for the food bank. She says the program is seeing so much success, it just received a $3.8 million federal grant to expand and study different approaches with medically tailored groceries. Participants picking up the meals, delivering the meals directly to their home, and home delivery that comes with education from a registered nurse as well as recipes. University hospitals, Metro Health Medical Center, and Case Western Reserve University are also involved. Elaine Borowski is a professor in the Department of Nutrition.
Our prevention center has been tracking retail stores for 10 years now. And Cleveland hasn't really changed. We have large pockets of the city where it's only a corner store that's available for folks. And so it's pretty hard to eat healthy in that space, right?
Do you think this step is enough to solve the problem here in Cleveland and Cuyahoga County?
No, it's definitely not enough. This is just one piece of the puzzle, but we think it's a controllable piece of the puzzle.
As for Joy, she says her son has some developmental delays and health concerns, but he's here. She believes expanding this program that once helped her is a plus, especially during a time of economic uncertainty.
It'll be an awesome thing.
Well, Case says the goal with this expansion and study is to have evidence to support the idea that these medically tailored groceries are covered by Medicaid, Medicare, and other insurance programs. That's what they want to happen. And what I love about Joy and her sharing her story is that she's now working as a community health coordinator for Pregnant with Possibilities. So she's giving back to women who were once just like her.
Yeah, and that just speaks volumes of the impact that program had on her. So great to see. All right, thanks for following through, Tiffany, as always.